guys? Welcome to the Zone Physical Therapy and Sports Lab podcast. I'm your host, Scott Kaylor, and I'm excited because today we have a good friend of mine, Caleb Walls, is going to be joining us. He is a doctor of physical therapy and is also a board certified specialist in sports physical therapy. And Caleb is the founder of Wall to Wall Sports and Rehab out in Arizona. I'm really excited to have you on the podcast today, Caleb. Thanks for joining us.
Hey, thanks, Scott. I appreciate it. I am excited to be on today and excited to get to chat with you. It's been a long time, and as I'm sure you'll touch on, we have some history there. So excited to chat with you today.
Yeah, so Caleb and I, we go way back, almost probably close to 10 years now, which is crazy to think about. When Caleb was doing his sports physical therapy residency program, I was on the faculty at the company where he was, and so we started our friendship then, and we're colleagues, and now it's just fun to see your business to grow and to blossom, and be able to have a resource when I need someone to call and chat about patient care or growing a business. So yeah, we've known each other for a while now. So I think, Caleb, one of the things that we really wanted to touch base with today, and I wanted to have you on the podcast, is you have a unique business model, and it's been fun to watch you grow it. And I think you do some amazing things with your patients. And so today I want this episode to really be around this idea of concierge medicine and kind of cash-based physical therapy clinics, and how we differentiate ourselves from that traditional PT model and some of the benefits that our patients have because of that. So I think that's probably a good jumping off point for our discussion today. Why don't you go ahead and kick us off and just define concierge physical therapy for us? What are you doing out there in Arizona?
Yeah, so it's a great question, Scott. I appreciate the question. And first and foremost, I want to say I didn't think I would ever be a business owner. I have no formal business training or education. I have learned on the fly. I am educated and trained to be a physical therapist and a great clinician, and I try to keep that in the forefront of my mind and lean on mentors and other resources to help me with the business side of running a practice. So with that being said, concierge medicine in general, at least out here in Arizona, it really seems to be taking off. And, I think to define concierge medicine, and we fall into that category, is just taking care of the individual, the client, the patient. And, most clinicians say, well, I put the patient first. And most companies say, I put the patient first. But if you look a little deeper into the nuts and bolts of it, you can see that there are systems and processes in place that work against the idea of putting the patient first. And so for
Mhm.
me, concierge medicine is truly putting the patient first and building your policies, procedures, and the model around that idea.
Oh, I love it. Yeah, our businesses are very similar in that way. We have some differences because I know you go to your patients' houses, and I think you guys have brick and mortar now too. Is that correct?
Yeah, so we have relationships with some facilities where we can go in and actually use their facility. We don't set up any blocks of time where we're just at that facility, but if we have a patient who needs some equipment that we just cannot get to them, and they would be in kind of a unique situation where they would benefit from some of that equipment, then we do have the option to take that patient into those facilities and treat them.
Yeah, oh, that's awesome. And so that's some similar. We're fortunate with our brick and mortar that we're trying to build out our sports lab. And if there's something that we need, we will try to acquire it, or I'll at least reach out to the manufacturer and borrow it for a little bit if I need to. Um, but I think where the similarities are is the same thing here at Zone is I wanted to create this space where patients could come in and have an opportunity to share their story. They don't feel like I'm looking over my shoulder for the next person coming in the door. And so we can go through their full history, and oftentimes very revealing for where we need to go with that treatment session that I might have missed out on previously. So that was our main thing, is let's just create a space where we're not in a rush. We can sit down with people, and then we can really be efficient within that time. And so I think It's fun to hear colleagues that are doing that all around the country and in a little bit different settings, but doing the same kind of thing. And I know you get the opportunity to go to your patients' appointments with them sometimes if they want you to be there. And we've done that with some of our patients, just be able to go and be a set of ears that can help process what the docs are telling them. We don't do that as much as we probably could. But when we do, it's certainly helpful. And in the type of setting we're in, it's helpful that we can pick up the phone and we have a close relationship with a lot of the docs that we're referring to. So I don't know if you wanted to chat any about kind of how you help your patients when they're seeing multiple practitioners and how you navigate those relationships and help either quarterback their care or go to appointments with them. Anything you want to share would be awesome.
Yeah, you brought up a couple great points there. You know, the time, time is valuable. Everybody's time is valuable, not just the clinician or the business owner, but the patient's family. They have jobs, they have lives, right? I mean,
Right.
and time is valuable, and I feel like the world that we live in is becoming more and more efficient. You have everything at your fingertips now as quickly as you want it, it's there. But healthcare has been moving in the sort of the opposite direction. Things take so long. You go to appointments or you try to schedule, and a doctor is booked out 6 weeks, 8 weeks, whatever it is. MRI machines are booked up. It just seems like there is a lot of inefficiencies in our system. And
Mm-hmm.
so we did the exactly what you're doing at Zone, and we block enough time to actually listen to our patients. Sometimes you need it, sometimes you don't, but we want to make sure that the patient does not feel rushed and does not sense us looking over their shoulder, looking over our own shoulder, waiting for that next patient, or in my situation, trying to get out of their home and get to the next patient. And ultimately, it provides a better experience and a more healing experience. Ultimately, we're trying to help somebody heal. We should not be adding stress and anxiety to their life. We should be like the Amazon in regards to healthcare, right? Where it's efficient,
Right.
no stress, and nice and easy. And so that's what we're trying to do.
Yeah. Oh, I love that. What are some what are some of the feedback or things that your patients are telling you that they appreciate about what you're doing with them out there?
Well, I think they can feel exactly what we're talking about, right? I mean, that's the feedback that, well, if you talk to the general public, about our healthcare system in general, you'll hear some similar complaints like the patients don't feel listened to, they feel rushed, etc. And then when I was in a traditional clinic, I felt the burnout as a PT, right? I mean, I was averaging 15 visits a day, which doesn't seem like a ton, but it is when you're trying to listen and change your plan of care and provide high level of care to 15 patients a day and then document and write the notes on those patients. It's challenging. And so we do have a high turnover in the outpatient physical therapy world. So I think both sides of the equation feel rushed and feel overwhelmed. And we just tried to fix that problem. And the feedback that I'm getting from my patients is that they believe in it and they appreciate it and they're willing to pay out of their pocket for that service because they feel the increase in value is there. And many of them have failed or had bad experiences in the traditional model previously.
Yeah, yeah, I love that. And for us, when we're talking with a potential patient or even a current patient and trying to figure out their plan of care, we're able to, have a more predictable outcome because of the type of the setting that we're in. And all the time we are constantly referencing the thing that's most important to them. Like we hear them that pain is no fun and we want to get them out of pain. But like for what you and I do, that's just like step one, right? Like we really, when I talk with my team and we're trying to figure out how can we make our patient experience great, it's always getting them to be able to dream in 3D. Like, hey,
Yeah,
if your back didn't hurt,
I love
what
that.
would your golf game be like? Hey, what would
Yeah.
you like to be doing? Like, would you be out there 4 days a week or 5 days a week? And and really getting them to like, oh, okay, so you hear me, like you know that these are my key indicators of the things that I want to get back to. It's not just because your back hurts or your knee hurts. So um that's yeah,
Oh,
you're
I love
welcome.
that.
I didn't invent that phrase. I took it from someone else I was listening to, but I love
Take credit for
just like when we can dream in 3D, it really just allows us to be able to really connect with the patient and let them know that they've been heard. So yeah, you can have that
that.
one.
And really what you're talking about in a higher way is just like goals, right? And goal setting. And I'll be honest, I probably shouldn't say this, but writing goals in as far as documentation and patient care, it's always driven me nuts. And I just hated doing it because, yes, I would communicate with the patient, understand what they're striving for, but then we would have to write goals in such a manner like 2 weeks, 4 weeks, 8 weeks, long-term goals. And some of those goals did not feel real when we
Yep.
did that. It felt like, hey, we're setting this up for insurance purposes to make sure that we get sessions approved. And it just didn't feel right or good. And now when I sit down and spend 60, 80, 90 minutes with a patient and I really learn about what they want to do, whether it's, you know, throwing a baseball, playing high level sports, or they want to be able to play with their grandkids or go for a walk with their grandkids, right? You get to the bottom of truly what they want to do, and then your entire plan of care revolves around that.
I
And not
love
necessarily, well, you only have 20 visits in a year, so how are we going to manage this, right?
that's
We can
right.
only use so many visits. It's like, no, no, let's get you back to walking the neighborhood with the grandkids if that's what you
Yep.
want to do. And all hands on deck to
Yep.
make that happen.
Yeah, just give our best professional recommendation, let the patient decide, right? And
Yeah.
be such a
It's
more
really freedom, right? It's freedom
yep.
for the clinician and it's freedom for the the client, the patient.
Yeah, I love those discussions. For any of our patients that are going to listen to this podcast, they'll know like we do a cheesy XY graph, and I love it. And we train all of our team on it. And when they talk, we'll draw that top two or three things in the upper right hand corner and draw a line to get there. And we try to make it as interactive as possible and be like, if this is the thing that you want to do, tell me a couple of things that you think would be precursors to that. And they're really helping us develop their plan. And so then they can see like, okay, we have a clear path to get from point A to point B and everything in between so that it's not just scattered all over the place. It's going to be a fairly linear path. We know that real world happens and flare-ups happen and travel
Yeah.
schedules happen, but we do our best to try to
This,
try
right?
to stick to it. Yeah, but we still have our markers to shoot for, it
Yeah.
doesn't allow us to go way too far off the path. It's just like a small subtle shift instead of trying to turn the whole cruise ship around.
And you have patient buy-in. They're a part of the team at that point, right? Because
That's yeah,
you and I both know, and the further into my career, it's more and more obvious that we can only do so much, right? We can provide all the resources and the hands-on treatments, but that patient has a critical role in helping us help them. And
yeah.
so when they're creating and involved in writing that kind of chart, that graph that you're using, they're immediately involved and taking an active role in their care.
Yeah, amen to that. Well, tell us a little bit about some of the unique things that you're doing out there. I know, for instance, one of them is the use of the musculoskeletal or the diagnostic ultrasound. If you have any others, we'd love to hear about them.
Yeah, so we are a full service orthopedic practice, albeit mobile, right? So a lot of people ask, well, how does that work? So we bring a lot of equipment into someone's home, but also we are very creative in finding ways to achieve the goal of the exercise or whatever it may be, the outcome of what we're trying to get to without large equipment. And so sometimes we have to be a little bit creative there. And then within a fee for service concierge model, it allows us to take an honest assessment and then provide the feedback of what we as clinicians and as experts feel would get them to to their goal. So if that is dry needling, if that is instrument assisted soft tissue work or cupping or imaging or whatever it may be, that is an option for us. We don't have to go and get insurance approval, which is really, really nice. It's just one less hassle, and it allows us to implement those modalities or treatments the day of, right? So it's a very, very efficient system. So yesterday I had a gentleman that I was treating for something unrelated, and he had some knee complaints. He filled me in on his history about his knee, and he was interested in what it looked like and if there was some arthritis developing in that knee. And I said, hey, let me grab my ultrasound machine out of my car. It's excellent at looking at these types of pathology. And we spent 20 minutes. We took a look at his knee, right? And that was just on the spot. He gained a ton of valuable information about his knee, as did I. And then we had a discussion about some of his options and what that plan of care might look like for his knee. In that situation, outside of this model, what typically would happen as a physical therapist in a clinic, say, somebody complains of their knee pain and I'm treating their shoulder or something unrelated. I'll say, okay, well, go back and see your doctor. That may take a week or 2 or 3 or 4 to get into your doctor. Let's get an assessment from the doctor. They're probably going to refer you back to physical therapy. So we'll get you back in here and we'll start treating that. Let's say physical therapy is not progressing the way that we think it should. So we send you back to the doctor. The doctor then wants you to get an image, right? MRI or something, something like that. That's going to take a week to get you scheduled, get the MRI completed. And then let's say there's nothing surgical in that MRI. Well, then you're going to come back to physical therapy and continue your plan of care. So that's my point regarding the inefficiencies of our system. Let's just take a look while we're there in the home.
Yep.
The patient's complaining about it. Let's take a peek and see if it's something that we can start helping them with immediately. So
Right.
ultrasound imaging has been a game changer. It really has for this type of practice. It is something that not a ton of physical therapists are doing quite yet, but I think it's coming. It takes a ton of training and you have to have the right equipment, but it's exciting because the machines are small enough to be mobile now, and the quality of the image is outstanding. And the literature shows for certain tendon injuries, it's as specific and sensitive as MRI. So like our
Mhm.
rotator cuff, if you have shoulder pain or concerned with rotator cuff pathology, that is a very, very valuable piece of equipment that we can have with us at all times. So outside of the imaging that we use in the traditional physical therapy services, your instrument scraping, your dry needling, those types of services. I also utilize handheld dynamometry strength testing with all of my patients. So I use a small device that reads the amount of force that you produce out of your muscles so that we have an objective number that
Yep.
we can track over time. And if you look at the research and you're providing evidence-based care, and you're not using some kind of tool to get an objective muscle strength number, I don't know how I don't know how you do your job,
That's right.
because you can't track it and you cannot um, properly diagnose or track outcomes without it. So that is a machine that we use with everyone. And then we are developing golf specific programs utilizing force plates. So we'll have force plates soon that will really take our golf performance exams to a different level.
Oh, that's awesome. Yeah, we have some very similar tools that we use, from the dry needling and the instrument assisted tools, and those can be a game changer in helping somebody just to put the fire out, get over the hump of their symptoms so that we can start loading their joints and their muscles appropriately to get them back to the stuff that they enjoy doing. We invested in a class 4 therapy laser last year, and patients have loved it. It's been a tool I wanted for a long time, going back to my days doing my fellowship with the Royals, and they had every tool at their disposal, and always wanted one, but they're a bit pricey, and finally
Sure.
just borrowed a few of them from the manufacturers and was just tried it on all of our patients that came in, and we just got such good reviews back from it. I was like, all right, it's time. Let's go ahead and get that. That's been a fantastic tool. And our running lab. The next time you're out in South Carolina, I want to show it to you because we have fun in there with our 3D gait assessments. We're working a lot with runners, but we're using it with our patients too, just from a walking standpoint after a knee surgery or a knee replacement, and just giving us some real awesome left-right data. And we now have on more like on the wellness side, we're doing VO2 max testing, resting metabolic rates, and it's really helped us to fine tune some people's programs on the performance side. So like our marathon and endurance type athletes, but with the big push in health and knowing your numbers, it's been really helpful to just motivate some folks to be like, well, here's where you are relative to your cohort. And the goal is to be in the top 2%. So what are the steps that we're going to take to get there to have more healthy years of our life? We're not just looking to add some years at the end. We want to maximize our time while we're here, and we want it to be healthy, and so we can continue to travel and play golf or go do whatever the thing is that we love doing. So
I
um
love I've been following you guys on your Instagram page, and as well as your previous podcast just about your running lab. And it's cool. It's a niche that you guys have that you're passionate about. I mean, I know you have quite a history in endurance sports in general, and I think some of your clinicians do as well.
right.
And so why not treat a population who shares the same passion as you do?
Yep.
That's golf for me. I'm one of those crazies that that could be part of the reason I'm in Arizona. Don't tell my wife. Um, that may be one of the reasons I left South Carolina and headed where I could play a little bit more year round out here. But no, I think the gate lab that you guys have is phenomenal because you have a passion for it and you're going to help other people who have the same passion. And typically, those people are going to be very analytical and want all of that data, just like
Right.
and you guys now can provide that to them, which is really cool. And it made me think too, you're just talking about the really unique equipment that you have in your space and talking about the wellness and performance side of things. Well, that's something else that you and I now have complete access to, right? Is
Yep.
like we can treat performance and wellness, which is probably something that you and I know pretty well from our sports residencies and our board certifications. And where I felt I was somewhat limited in the traditional settings and models, I felt
Yep.
like I was limited and maybe not able to utilize all of the skills that I had learned from you and my fellow mentors there in South Carolina. So it's pretty cool.
Yeah, that's awesome that you're starting to implement some of the force plates. I have some force plate reps that are coming to hang out with us in a few weeks so that I can look at them and see if we can get some data. And you'll be happy to know I started playing golf again.
Oh, good.
I'm not any good at it, but been fortunate to treat some guys that play out on tour, and they encouraged me to get back out at it. And so now I'm getting back into it. So when I come out to Arizona, we'll have to go play sometime.
For sure. I would love that. I would love that.
Um, what I would love to hear from you, and then I'll chime in as well, is if you had a potential patient who's listening to this and they are either frustrated because they can't do the things that they want to do, or they're having some pain, tell them why they should give you a call.
Well, first of all, I'll pick up the phone. Um,
That's right.
Man, it's frustrating to call somewhere, anywhere, whatever service you're looking for, and you just can't get a call back. So that's number one. Somebody's going to answer and talk to you, and more than likely it's going to be myself or my assistant. So we do free discovery calls. So I volunteer time to chat with somebody over the phone to learn a little bit about what they're dealing with or what their goals are and what they want to be able to accomplish, and then have a frank conversation about whether or not I think that we're a good fit.
Yeah.
for that initial assessment. So there's no strings attached by calling and saying, hey, this is what I have going on. Do you guys help? Can you guys help me? And if so, how? And then after that conversation, if it's a good fit, then obviously we'll get you scheduled. We can typically schedule somebody within a week, and we can be at their house within a week. We communicate with any physicians that they give us access to get any history, and we can communicate on their behalf with their physician. And then, at that initial assessment, we block 90 minutes, which is more time than you're going to get at most facilities or doctors' offices. And you will be seen by a doctor of physical therapy who's a board certified specialist every single time. And we're going to get to know you and your entire health history. And we're going to put a comprehensive plan in place for you and give you all of the tools and resources that you need to take an active role in getting better.
Oh, I love it. Yeah, very, very similar, in that when we talk with somebody, we are trying to find out just as much, um, if we're going to be able to help them, if we think they're the right fit for us, because,
Yeah.
if there's not a good connection there, relationship, or maybe they need something that isn't in our wheelhouse, we don't just want to take anybody, because both people get frustrated in that. So we will send them to the appropriate person in town, that might fit that better. And so I just think there's a lot of value, and there's, like, I think you said it great, like there's no strings attached. Like, let's just see if I'm a good fit for you, and let me hear your story. And if I think that my team and I can come alongside you and guide you to where you want to be, and get you back to those things, then let's do it. So
Yeah, I
just,
think, sorry, go ahead.
no, no, you're good, man. I was just saying, it's just fun to hear other like-minded clinicians that just have a passion for wanting the best outcomes for the people that they work with.
Yeah, and I tell folks all the time that have worked with me, I say it's really what you're paying for is to have a sports orthopedic wellness specialist in your hip pocket, right? So if
Mhm.
you're somebody that wants somebody that knows you and your health issues that you can turn to and lean on when things pop up, that's the service that we offer, right? So not only are we taking care of you currently, whatever injury that you're having, but we really truly get to know you. And then you have somebody that you can trust and lean on. And I just tell them you have somebody in your hip pocket that you can actually pick up the phone and talk to and can give you some direction in regards to what to do for your orthopedic injuries.
Yeah, same. And we either via text or some of our different platforms that we use, we always tell patients, even if we don't have you on the schedule until next week or the following week because of a trip or whatever you have going on, please don't
Right.
feel like you have to wait the 7 or 14 days to let us know that something's not going as well as you think that it should, because let's troubleshoot it. And I'll snap a video of myself doing a modification of
Yeah.
an exercise or doing some kind of technique that gets some pain relief, and just say, hey, try this. Let me know how it goes. Or, like, I had a lady that was traveling up to New York recently, and it was like, hey, let's just hop on FaceTime real quick. It'll be way easier to troubleshoot this.
Yep.
Show me what's going on. Perfect. Okay. Now work on this instead before you hop on your flight to head over to Europe, or I don't remember where she was going, but you get
Yeah.
the point of, like, let's troubleshoot it in relative real time.
It's just amazing. And I think back 3 years ago when I was in the clinic and signing off on 70, 80 visits a week, like I didn't have the capacity to do that. Even though I wanted to, I wish I could say, hey, here's my cell phone number. Call me if there's an
Yeah.
issue between that. You can't do it. And I've worked hard to put myself in a position to be able to do that. And also um it creates a quality in my life and with my family and just some balance in my life that I think my patients can feel as well. We haven't touched on that at all, but I just think that's it's such a positive impact on my life that bleeds over into the care that I'm providing to my patients.
Yeah, that's well said. Well, is there any other parting thoughts that you want to have on this episode? I know we're going to have you back when we talk some sports performance and kind of some of that later phase rehab, and particularly with the professional athlete. But if you have anything you want to add to today's episode, fire away.
Oh, I don't know. I don't know, Scott. I haven't been in South Carolina for a long time, but you're in Greer, correct?
I am.
Yeah, also have
Yeah, we just moved to our new location at the time of this recording just a couple months ago. So we're having a big grand opening event next week, and it's going to be awesome.
Awesome. When is the grand opening? What are the
It's on March the 14th from 4 to 8 p.m. and it's going to be good.
Awesome. And do you feel like you're hearing and seeing more concierge medicine practitioners there? Not necessarily in the PT realm, but primary care doctors, direct primary care doctors. Are you guys seeing that in that part of the country as well?
We are really across all healthcare professions. It's becoming more and more that way as burnout is a real thing. Patients are frustrated with current systems or hurdles that are in place. And so more and more of probably the docs that you remember and that we work closely with are getting frustrated by that. So setting up their own clinics. Our PT colleagues are doing the same. And hopefully, I hope it's a groundswell to create just a movement within healthcare that really the patient should be at the center, and the insurance company is not supposed to be the center that dictates everything. And so, yeah, we're having same kind of things that you're having in Arizona.
Yeah, I was glad that you touched on that because, that's the feel that I get is that this is happening all across the country, which is exciting. I'm excited about it. And I will just say one other thing, potential patients out there that might find this or listen to this podcast, you're probably thinking, oh my gosh, this service is outrageously expensive. I'm sure of it. And it's really not. I mean, the value add is significant and something that we can provide. I'm sure you guys do this, Scott, but for most commercial insurances, we provide what we term super bills, but they're detailed invoices. So after our service, we provide that document to you, and the patient can send that into their insurance. And a lot of times out of network physical therapy coverage, they'll reimburse that patient directly. And so there are still options to get some portion or all of those fees for service reimbursed. So I would encourage anybody who is looking for a different type of PT service is to reach out to a concierge practitioner and chat about some of those things and see if it's a good fit.
Yeah, I would echo that. We do the same thing. And, we would never say that it's not an investment. There certainly is hard-earned healthcare dollars that patients are spending with us, and we're very appreciative of that. And we want to always try to remember that. And but at the same time, like, we have a lot of big healthcare systems around us. And when you look at the itemized receipts that those people have paid for, if they have a high deductible, they're oftentimes spending significantly more for their physical therapy care when they don't come and
Right.
see us. And they don't always realize it because that bill doesn't come until down the road. When I used to manage one of the big shops in town, that was one of the most common complaints or frustrations when I would have to meet with a patient that was like, well, you told me it was going to cost X. And I was like, well, no, that's your copayment, or we collect that much until it processes. I'm sorry that wasn't as clearly stated as you thought it, or as we could have made it, or that whatever. But yeah, so we certainly want to acknowledge that we know patients are spending money, and we want to value that when they decide to come in and work with us. But just because they are in network with someone doesn't mean they're going to save money a lot of the time.
No, I love that. I think that's a great point. I'm glad you brought that up.
Yeah. Well, this has been a fun conversation, and I know you and I can talk shop for hours because I think we've done it before.
Yes,
But I am going to end this episode, and I look forward to our next episode. So Caleb from Wall to Wall Rehab Sport, or Wall to Wall Sports and Rehab, thank you so much for being on, and we look forward to our next one.
I appreciate it, Scott. Thanks so much.